Good day everyone, I'm Alexander James Y. Palad from BSN 22. So for today, I'm going to show you the proper procedure of Leopold's maneuver. We need to assemble all the equipments that we're going to use. We have a stethoscope here, and we have also a gloves. Good day, ma'am. I'm Alexander James Y. Palad, and I will be your nurse for today. May I know your full name?
I'm Royce.
Okay, Miss Eugenio, that's great. So for today, we will be doing a Leopold's maneuver. We will be able to determine the fetal presentation and the position of your baby. So is it okay with you? Okay, that's great. After assessing Miss Eugenio's AOG, she is currently in her 28 weeks of gestation, and it is possible to do the Leopold's maneuver. So after the procedure, the fetal presentation and the position of the baby will determine, and also the fetal heart tone will be located. So, Miss Eugenio, I'm going to explain the procedure for you first and what is contained in each steps.
Yes, please.
Okay, so for the first maneuver, it will help us to identify if your baby is in breech or in cephalic presentation. Meaning, if the baby's head is on the fundus or buttocks, or if the baby's head is at the bottom or the buttocks. For the second maneuver, it will help us to identify where is the baby's back is, and it will help us to locate the small parts or the arms and legs. So for the third maneuver, it will help to confirm the first maneuver. Meaning, if what we found in the fundus is the head, then the buttocks is at the bottom. Then, if buttocks is located at the fundus, then the baby's head must be at the bottom. So, for the fourth maneuver, it helps to tell whether the baby's head is engaged or not. Okay, ma'am, have you gone to the toilet? Okay, that's great. Can you please flex your legs slightly for me? Okay, that's great. Thank you. So I'm just gonna put a pillow under your hips. So, ma'am, can you please sit for me? Then I will put some pillow under your hip. Just easy as the procedure. So I'm going to assist you, ma'am. Okay, thank you. Okay, ma'am, shall we start in our procedure? Okay, so ma'am, I'm going to expose the area wherein we will palpate. So is it okay with you, ma'am? Okay, so I'm going to expose the area. So I'm going to lift up your shirt. Is it okay with you, ma'am? Okay, so I'm going to expose it. Okay, so now, ma'am, we're going to proceed on the first maneuver. So I'm going to place my hand on your fundus like a triangle shape. We're going to palpate the fundus. So if we feel that it is soft, then it is the buttocks. Then if you feel hard, it is the fetal's head or the baby's head. So now, ma'am, for the second maneuver, we're going to determine the baby's back and also the small parts. So hold right hand still, and with the gentle pressure, then using our left hand, we're going to feel the firm, smooth back. Okay, so if once the baby's back located, we're going to palpate for the fetal extremities on the opposite side. Okay, I'm going to palpate it. Then we're going to search for the small parts as well. So for the third maneuver, I'm going to place my hand on your suprapubic area, ma'am. Is it okay with you? Okay, that's great. So I'm going to check for the baby's head if it is engaged or not. So the baby's head is still able to move and is pushed upward as I place my finger here. So the baby's head is not yet engaged. So now for the fourth maneuver, I will put my both hands on the uterus area. So is it okay with you, mom? Okay, so we will now feel for the cephalic prominence. Then we will feel if the baby is extended or is flexed. So I'm going to push it here. So Miss Eugenio, I'm going to put back off your shirt now. And I'm going to cover you a blanket so you don't feel cold. Thank you so much, Miss Eugenio. So now I'm going to validate the data that we've gathered from Miss Eugenio. So Miss Eugenio is currently in her 28 weeks of gestation. Then the head of the baby is located at the uterus area, although it is not yet engaged and still floating as it is still movable. So now I'm going to discard my PPE. Then place it on a proper receptacle. Okay, so now we're going to list down the significant findings. So it seems to be doesn't need any immediate attention. So everything went normal. So I have here my patient's chart. So we're going to document the findings on the patient's chart. So after the procedure, we're going to evaluate the presentation and the position of the baby. So the baby is at a cephalic presentation, although the head of the baby is not yet engaged and it's still floating, and we were able to determine and locate the fetal heart tone. Thank you for watching. Bye!